So there are a lot of challenges within the field of orthopedic surgery in general, especially for women in orthopedics.
Currently there's about 7% women in the orthopedic workforce. There's about 14 to 16% women in the resident workforce, and clearly that's not anywhere where we need to be.
Ruth Jackson was one of the first female orthopedic surgeons and has had a tremendous impact on the field, and certainly for us as women in orthopedics.
So Ruth Jackson Orthopedic Society was a society developed in 1983 by women who realized that there weren't that many women in orthopedics.
And we want to be the specialty organization not only for a gathering place for women and for men now, but also for education, mentoring, sponsorship, and promotion.
Perhaps if I had to sum up Ruth Jackson for me, it's that it prepares women throughout their entire career to be successful orthopedic surgeons, and that's really what moves our profession forward.
My first Ruth Jackson meeting was when I was a resident 10 years ago. And when I walked into that meeting, I was one of maybe 3 black women in the room. So being a black woman in orthopedic surgery, we're a very small number despite the number of black female patients that we see.
So we've really gone out of our way to make our organization as inclusive as possible. We've sought out folks to serve on our committees and be in our leadership roles.
And this year, I just took great pride to see the largest meeting that we've had with Ruth Jackson and the overwhelming representation from women of color and the younger generation of women.
Last night was, I think, a really powerful and sort of inspirational event. There was gender, racial, ethnic diversity that was impressive, and I think that speaks volumes to what we're trying to do within RJOS and where the priorities are, and that we have been intentional, very intentional, especially over the past few years, at improving diversity within RJOS.
Diversity of gender, of race, of sexual orientation, but even of life experience, all of those things feed into who you are as a physician.
So without doubt, orthopedic surgery is the best specialty in medicine, not that I'm biased at all. But you have to find a home where you fit, where you are valued, where you are respected.
So my best advice for young women pursuing a career in orthopedic surgery is find mentors early. Really identify women who you want to emulate, and that is your best path forward.
I recommend that any young woman pursuing a career in orthopedics become a member of RJOS because of the multitude of educational offerings we have, the multitude of offerings which are outside of the spectrum of just orthopedic surgery.
And for these young female students considering a career in orthopedic surgery, absolutely become a member of RJOS. There are so many resources and opportunities and support.
We provide a home for like-minded individuals. If you're struggling, we provide that shoulder with which to lay your head or an ear to listen to. And so I think we're the village that you need.